Hey everyone. A little overdue for an update. I was originally planning to do a 3 weeks post-op video, and it's been about 5 days since that, so it's 3 weeks and 5 days. So today is day 26. It's a Wednesday, but some cool updates. On Friday of last week, at the 3 week mark, my physical therapist talked to me about how I felt walking around in the brace without the crutch and some other things, and I was officially allowed to stop using any crutches as long as I felt comfortable. I'm still wearing the brace for a while, but just being able to walk around without having anything in my hands, of course, frees my hands up and is allowing me to start putting more weight on the leg, and things are going really, really well. Additionally, towards the part of that day and in the latter couple of days after that, or the subsequent couple of days, the strips were coming off. They've come off completely since then. So now I'm just walking around without any covering on the incision site. I'll show you that in a little bit. But I'm walking around without anything in my apartment. So not even a brace, not a wrap, not anything most of the time. And overall, things are going really well. We've started doing a little bit of squatting in the at the PT clinic during my sessions, and I'm doing a little bit of active knee extension just at the end of my range for the most part. Additionally, on Friday, I got to 100 degrees of knee flexion, and today in PT, I managed to get to about 105 a little more easily, so I probably could have gotten like 107 or something, I think. Had a little bit more in the tank, but I was able to get to 105 cleanly without too much discomfort. It wasn't intolerable anyway. And overall, things are just progressing nicely. Oh, don't want I'm kind of holding my phone. It's half balanced on something here. So overall, I really can't complain. Things are going well. Just continuing to get up and down stairs, and I'm not really putting a lot of weight on my surgical leg when it comes to stepping down. I can walk upstairs without using the handrails, though I'm not doing that aggressively just yet because I haven't really been cleared to. I'm still working on getting those last few degrees of knee extension. That's been tricky, but the flexion continues to improve. I'm able to sleep on my sides, on my left or right side, and on my stomach. I can put pressure on the knee, on the front of the knee a little bit. The incision area really doesn't feel that bad, but it's overall it's doing well. So I'm gonna move this down here, or actually even down here, so you can see. Let me tilt this a bit. Kind of how I'm doing. Here we are. Walking backwards is getting easier. Basically, it's just I've gained enough confidence that I can shift my weight onto my left leg, and I can't stand on it like for long periods of time really, but I can keep my weight on it here long enough that I can step. I can shift my weight side to side. I'm not being aggressive with it, and I'm still picking my foot up completely. If I have to turn, I can pivot on my good leg, but I can't pivot on this leg yet. That's going to take some time. But as you can see, I'm walking around pretty well, and the limp is becoming less and less pronounced as time goes on. So I think this is really good. From over there, you can see probably that there's an incision. My eyes aren't good enough to tell on the screen there, but I'll give you a closer look to see how everything's looking. But yeah, things are good. I still have like my crutches right over here, and I still have my cane in case I want to, take a break. If I'm feeling really tired at the end of the day, I will sometimes still have my cane just like give me a little extra support. But for the most part, it's not an issue. And this is really good for probably my most challenging task of the day, which is getting in and out of the bath. I'm still not doing standing showers just yet. Maybe in a few days or something I'll try it. Just because I want to make sure that I'm really stable, more stable anyway, when I'm on a wet ground, I don't have a seat in my shower or anything, so I have to be able to stand. So I'm giving that a little bit more time. But getting in and out of the bath is better, and one of the things we've been working on, I'll put this away, is stepping over things. So at first it was just an obstacle maybe about that high, I don't know, 5 inches or something, and just trying to get enough knee flexion that I could step over stuff. And I'm going to angle this down a little bit more. There we go. Oh, don't fall. Hopefully it won't fall. But as long as I don't have too heavy of a step. But basically, being able to lift my foot high enough that when I move it forward, I can clear an obstacle. This is big for obviously stepping over speed bumps or stepping on a curb, going up and down stairs, all these little things. We take the amount of knee bend for granted. Now it's tight here, but it doesn't really hurt. I can go farther. So we started this last week, just kind of stepping over things. And today we started stepping backwards. And I had to hike my hip a little bit because they started giving me taller obstacles, things that were closer to like a foot in height. And I really, really had to work hard on it. But stepping forward and stepping backwards, and of course I can't just let my foot dangle, I have to really dorsiflex a lot. But stepping backwards, and then picking my other foot up, it's challenging, but I'm getting there. So I think things are going well. In 2 days I go back for another PT session, so that'll be 4 weeks post-op. And so I think we're going into a month looking pretty good. I'll give you a closer look at the incision so you can see that. And here's what I'll see if I can do this. I don't think it's going to let me flip it, so I will just angle it like so. Actually, let me sit down. Maybe I can sit. I'll just get on the floor here. Still slow, but I'm moving a little better. So you see here, that's it. Around, laterally there was a tunnel that they use here. And so obviously it's still discolored and there's still swelling, and I'm gonna move things around. We're starting to mobilize the kneecap some more. This doesn't really hurt too much. There's a little bit of pain in here. And that's gonna be the case for a long time. But all in all, I really can't complain. I think things are going really well. Most of the bruising has dissipated. There are like little spots towards the back of my knee and stuff. It's still a little sore here, a little bit kind of, I guess I would say baggy. That is, there's a little bit of difference in terms of how the fluid is sitting or accumulating. Trying to get my quad to do more stuff, the contractions are coming back. Now this knee is not on the floor. Like my right one, I can actually even kind of hyperextend. You can see that my left one is still a little high. If I sit here and work on it, I can get it closer to straight, but forcing it is not, that's not the plan. Soon we're going to start working on things like hamstring stretching, a little bit of passive work there, and calf stuff as well. But for now, we're not quite doing that because of some concerns about, how much stress that might put on the new ACL and the resulting strain that the tissue might undergo. Strain being deformation of that tissue. So we're waiting a little bit longer, but come Friday, so a couple more days, I think we're going to have some updates there as far as what we can do. Again, I'll just give you kind of angle it in the light so you can see I had just a couple little stitches there. And here we are. I'll sweep or circle around. So get a decent idea of what that looks like. And, the length there. So I don't know what's that, about 4 inches, something like that. I know sometimes this procedure is done arthroscopically, but it wasn't in my case. But I'm okay with that, really. Considering what was done, it doesn't feel as heavily traumatized as some of the knees that I've seen. The swelling continues to go down. I don't have to wrap it before bed. I'm able to, things can rub over the incision. It doesn't really hurt too much. The therapist worked on massaging it and kind of mobilizing it a little bit today because as it's healing now, I can tolerate that. The idea is to keep things from sticking too much. Keep weaker adhesions from turning into stronger ones, from turning into full-on scar tissue. So we're working on that. It's a little uncomfortable when they get in there, but all in all, things are going okay. And I'll keep you updated on how the tissue is sliding, how things are moving, how my strength is going, my range of motion, all that stuff. If you want to see range of motion real quick, I'm resting in this position. This isn't too bad. I can pull it up. So we're at about 90 right there, or maybe even a little past 90. So I can approach about 100 degrees before I start feeling a lot of tension. And if I really work up to it, I can go farther. Like I said, today I got 105. Let's go a little farther. So now it feels uncomfortable, but, not too bad. Just want to start rebuilding my leg. Obviously, my left thigh is not quite where my right thigh is in terms of the ability to engage the muscle as well as the bulk of the muscle right now. So we'll keep working on that. Anyway, we're at 10 minutes here. I didn't want to rant as long as I already have. Hopefully, if you've been watching my other videos, you find this kind of informative and helpful. And I will also be posting updates as I return to more intense exercises. I am going to the gym, doing upper body stuff, so I'm balancing. Most of my lower body stuff is focused around PT right now for obvious reasons. But I'm enjoying it, actually. It's nice to have all of this. You know, the ability to go to PT and just being able to get the surgery. I waited better part of a year to get it, so I'm thankful. And I'm just trying to enjoy the ride, you know, and learn from it. So hopefully other people can learn from it too. All right, I'm gonna sign out. Thanks for watching, and I'll give you some more updates hopefully before too long. Take care.